Hi there, Ronnie Smith, RRT, back again. This time, this is going out to all the possible future respiratory students and therapists out there. The thing I want to talk about is transmission of diseases. Okay. Now, in a hospital setting, as anywhere, you don't want to spread nothing around, especially if you have a cold or anything. So, the best things to do if you feel like you got to cough or sneeze while you're at work or at your clinicals. Bring your sleeve up and sneeze or cough in your sleeve. Okay? Now that works, but the problem with that is if you sneeze or cough into it, you're going to have contaminants on your sleeve. Okay? You can actually bump up against someone, or you might have to help lift someone. It's going to get on them. Method I prefer is to grab the bottom part of your scrubs right here, pull out, cough and sneeze in that way. Okay? The reason is, whatever you cough or sneeze out, it's going to go on the inside of your scrubs and on your skin. Okay? You let go, it's not going to be transmitted to no one else. Alright? That's just something to think about. Another thing to think about is ink pens. Because you're going to be doing a lot of writing in the hospital. Get you a good ink pen. Alright? A good one. This here is just a cheap, flimsy one. You can find these in the hospital anywhere, at the nurse station. Comes with a lid. Don't get these. Alright? The simple reason, you lose the lid, it's going to dry up on you fast. Okay? I don't like pens that come in two parts. Okay? So don't get these. Get you one like this. Okay? Something that you can put in your scrub top. You can get these at Walmart. Buy a pack of them. And I would suggest carry 2 of them on you at all times for backup. Okay? 1 is good, 2 is better. Always remember that. Just put the pack in your bag or in your locker, and make sure it fits good to your hand. Alright? Because, like I said, you're going to be doing a lot of writing in the hospital. Writing out reports, signing your name, and at the end of the day, if you do a lot of writing, your wrist is going to be hurting a lot. Okay? So, just want you to think about that. This is a good pen. These are bad. Good, bad. I know what I'm talking about, people. Second thing, well, third thing I want to talk to you about is stethoscopes. Okay, I cannot stress this enough. Get you a good stethoscope. Alright? Check online. Even if you have to pay almost $100 for one, it'll be worth it. Okay? Because you want to pick up good breath sounds and cardiac murmurs with your stethoscope. Alright? Don't go out and buy a cheap one, a flimsy one. Like you go to a drugstore, buy one for $4. Okay? Unless you can hear good with it. If you can hear good with it, great. But if you can't, if you have to spend a little extra money, get it. Okay? Because it really help diagnose your patients. Another thing, keep it with you at all times. Keep it right around your neck, or keep it in your pocket. Always make sure your scrubs have plenty of pockets, whether on your pants leg or your scrub top. You don't ever want to take your stethoscope off and leave it somewhere. Alright? Because that's how they get stolen. Alright? Keep it with you at all times. Either around your neck or in your pocket. And make sure you get a little tag to put on it that says who you are. Alright? That way if somebody finds it, they can bring it back to you. Okay? Another thing, attire. A lot of hospitals are switching to different colors for their departments. Nurses are wearing certain scrubs, and respiratory therapists are wearing certain scrubs. You want to make sure to conform to the hospital protocol in your department, but make sure you get a pair of scrubs that fit you good. You don't want tight, you want them loose. Okay? Because you're going to be wearing those for sometimes 12, 14, maybe even 16 hours. So you want a comfortable pair of scrubs. Same thing with shoes. You want a good comfortable pair of shoes. Something that's heavily padded for walking on concrete floors, and something you're going to be used to running in, because you're going to have to run in the hospital. Okay? When they call, I hate saying this word, code blue, you're going to have to run to every one. Okay? Again, they can be a little pricey, but it'd be worth it. Okay. Now, when you get home, especially if you have a family like I do, don't take your scrubs off. Mix your scrubs with your family's clothes. Okay. What I do is I have a separate hamper. So when I get home, I can take my scrubs off, put them in that hamper. I'm gonna wash them separately from the rest of the clothes, because you don't know what could be on them. Okay. You don't want to bring anything home from work, MRSA, or nasty stuff like that. You don't want to give it to your family. So always remember, when you get home, take your scrubs off, keep them separate from the rest of the clothes. One other thing, keep a bottle of handy sanitizer with you or on you at all times when you're working. You can get different not colors, but they have different scents. You can get different types. I just like the plain old gel hand sanitizer. They're good to have in a have-to situation when you don't get a chance to wash your hands. You just pull it out, squirt some in your hand, wash your hands, and you're done. Okay. That's a good thing to keep with you, and you can buy them pretty cheap. Sometimes you can get them on sale at Walmart for like 89 cents or 50 cents. Or if you get a coupon like my wife does, you can get a ton of them. Keep some in your locker, keep them in your bag, keep them in your car. Keep them on you at all times. Okay? That's pretty much all I have to say for right now. Planning on the next respiratory video discussing respiratory equations. So I know what you're thinking, fun, but trust me, these are equations you could use in the hospital. All right. I know in school you're going to be learning a ton of equations, and the thing is, that ton of equations you're going to learn, which is this long, I can narrow it down to that much, maybe not even that. Okay, so once again, this is Ronnie Smith, RRT, signing off. Take care, and God bless.